Dr. Stephen Greenberg, along with Sarah, our head PA here at Greenberg Cosmetic Surgery. So we're here in the Southampton office. Exciting day. We're doing tons of injections and seeing a lot of consults for cosmetic surgery. So if you're in the Hamptons, come and say hello. We're here every week, at least once a week. So it's super busy out here. So there's a lot of new things going on in injectables. Come a little closer. So you can hear us a little better. Tons of new stuff going on in injectables. What's new? What's hot? What are we doing?
So the newest product that we're doing a lot of is something called Bellafill. So all these biostimulatory injections are really popular right now. They're not HA injections. So they're not Restylane or Juvederm. They're not made with hyaluronic acid. They're made with products that stimulate your own tissue. So Bellafill, Sculptra, all those products stimulate your own collagen, your own elastin to create more tissue and more volume. And it's more of a natural way to add volume over time.
And we're still doing a ton of regular hyaluronic acid injectable fillers like Restylane, Juvederm, all those sort of things, which we use in different areas of the face. And we like to individualize this. So we put different products in different places based upon the person's anatomy. If we're trying to fill the folds or the marionette lines, we do a lot of like liquid facelifts where we come along the jawline and give nice cheekbones. Individualizing this process is super important.
Yeah, you can't put those products in every area of the face. So if you want to do tear trough, you have to put a different type of product. You can combine that with Bellafill or Sculptra and Botox and keep up with your normal toxins every 3 or 4 months. But these are great ways to incorporate different volumes in different areas.
Yeah, now that you brought up toxins, so we do a lot of all the different types, whether it's Botox, Jeuveau, Dysport, Xeomin. We individualize this, and the toxins work great, like Botox for the forehead, the pubilla area, the crow's feet, and then there are other areas of the face, the platysmal bands, sometimes to turn up the corner of the mouth. So there's a bunch of different places that we can put Botox or Jeuveau or whatever we're using. And you're right, combining that with fillers are a great way to rejuvenate the face.
Yep. And then also combining all of your injectables with lasers is also good too. The CO2 laser, I talk about this all the time, but it is my favorite laser. If you don't have that downtime of a week to do a full deep CO2 laser, you can do the cool peel in the summer, and it's just a couple days of being a little bit red. You can put your tinted moisturizer right over it. But when you're doing injections, you also want to do the skin on the outside. So the CO2 laser, the new IPL that we're getting is going to be great. All these different things in combination help to just make you look more natural.
Yeah, and we do a lot of facelifts every day as well. Facelifts and eyelid lifts, super common. And everyone thinks, oh my God, you have to look fake. I'm into all about looking natural when we're doing our facelifts. And it's really important to rejuvenate the neck at the time, to really bring up the neck, to really bring up the jowl area. So those sort of areas are super common to do, and do whether a mini facelift or a different type of facelift at the time. So we're here in the Southampton office, and tune in. We're going to show some injections a little bit later. Stay tuned.